You don't want to miss today's episode. We are taking a deep dive into mental health and substance use in Florida and trauma. And we have two experts with us to talk about this issue that affects us in so many aspects of our lives. Hello and welcome to a deeper dive with Dara Cam. Today we're mixing it up a little bit. We're not in the terracotta room. I am hostessing two fabulous experts in the mental health and substance abuse arena. I'm at home recovering from a fractured tibia. So if you hear Max join in to give his 2 cents, you know where we're coming from today. We are really excited to have two special guests with us. Melanie Brown-Woofter, President and CEO of the Florida Behavioral Health Association. That is a nonprofit organization that provides statewide leadership on behavioral health policy and practice. And we will talk a little bit more about the FBHA later on in the show. Also joining us this morning is Melissa Larkin-Skinner, CEO of Centerstone of Florida. She is a licensed mental health counselor with 25 years of experience in mental health and addiction prevention and treatment. Thank you so much, Melissa and Melanie, for joining us on a deeper dive this morning.
Good morning. It's an honor to be here. And Dara, thank you so much for having us. We're thrilled to be with you today.
I wanted to just jump right into all of the issues that you all deal with. And we're talking about mental health and substance abuse. And there's a lot of components to each of those. I mean, we could spend one episode on each faction of what's involved in mental health and substance abuse treatment. We wanted to talk a little bit. Let's start with substance abuse, because I've been hearing so much. Everyone's been hearing so much about fentanyl and the dangers of fentanyl, and the impact that has had on all our systems. Can you talk a little bit about fentanyl?
So, Dara, you're absolutely right. Fentanyl is rapidly becoming public enemy number one. We have seen a rise across the state in accidental death related to fentanyl and to increased fentanyl use, which exacerbates then the symptoms, and the substance use disorder intensifies the treatment needs. It has certainly it has reached a crisis proportion, and we are very concerned. We want people, of course, to be safe, but we also want to be able to reduce the amount of fentanyl that is available. Obviously, fentanyl, when prescribed and used as a medical treatment, is safe and effective. But when used on the street, or when dealers or others lace other drugs with fentanyl, it becomes a problem because people don't know, and it's extremely dangerous.
Yeah, I actually just was treated with fentanyl in the emergency room when I fractured my tibia less than 2 weeks ago. And when they said, we're going to give you some fentanyl, my initial reaction was, oh no, because I've read and written so much about it and its dangers. But of course, they didn't send me home with any, and it was in a prescribed environment. I wanted to also ask you about this commission on the Florida Commission on Mental Health and Substance Abuse recently released an interim report. And I'll be honest with you, it seemed to me like a lot of the problems in the system still exist today. It talks about silos of information. Melanie, you may not remember, but you and I met again, or didn't first meet, but we met again in the aftermath of the Marjory Stoneman Douglas mass shooting, and there were several panels trying to come up with ways to address mental health issues, gun violence, and whatnot in schools. I think I met you both and spoke with you both at that time. can you talk about like shortcomings in the way that we provide mental health services and substance abuse services to people? And then maybe that's an opportunity for you to also talk a little bit about your association.
Uh, I think I'll take this one real
Yes.
quick. So I'm not sure I would call it shortcomings, but rather challenges.
Challenges. Fair enough.
And yeah, and it's because it's complex. So you have a system that has developed over time, over decades, right? It wasn't all just designed magically one day because we saw these needs and we knew what the future held. It was really piece by piece as needs of Floridians became known, right, to the legislature, to providers across the state. And I think that it's easy to look at it and say, oh, it's so broken. And there are broken parts of it. I've been doing this a long time, all of it in Florida. And there are broken parts, but there are also people who are constantly working to fix those parts. It's just that the system developed over such a long period of time. It's very large and very complex. And then you layer that, it's layered with federal requirements and funding that also developed over decades, as well as local. And so you have all these layers in the system, and it's difficult because of the way the system developed, but also because of the way laws work and funding works. It's difficult to just come in and go, oh, we've identified this and we're going to change the whole system around. It takes time. And the thing about the commission that is good is that it was designed to really take a deep dive. And what happens, and
We
this
like
happens.
deep dives.
What's that? Yes,
Like the
yes,
podcast.
exactly,
Yeah.
exactly. It's to take a deep dive and really focus in on the different parts of the system, because it's not something you can wrap your hands around or your arms around all
Right.
at once. And then hopefully what will come eventually is recommendations to look at how we can move toward something that will be more available at the time that people need it, so that everybody has access to whatever care they need exactly when they need it and not have to wait. I don't know about you, but I'm an impatient person, and I don't like to have to wait on anything.
Yeah.
And especially if it's something that I consider to be life or death for me,
Right.
or my loved one. So yes, there are pieces of it that are broken, but it wasn't because people were incompetent or didn't want it to be better. It's just how it developed over time.
Right. You have the Department of Children and Families. You have the, I forget what they call it nowadays, but you have the Department of Elder Affairs. You've got the Department of Juvenile Justice. You've got the Department of Corrections. You've got Department of Health. You've got the Agency for Healthcare Administration. So there's a lot of different organizations, and you've got the legislature, and you've got local governments, and they have certain requirements about, say, drug ordinances or substance abuse services that are available in Sarasota may not be available in Palatka. No, not picking on Palatka, just, for example. So there is a big state with a lot of municipalities and counties and a lot of different governing systems and a lot of agencies at work. And I'm guessing that maybe, Melissa, that's where your organization helps to bridge some of the gaps, or how does your agency help coordinate the delivery of services?
So my organization's been around since 1955, and we serve 6 counties in Southwest Florida. So if you think about from Manatee County, like Bradenton, through Sarasota down to Fort Myers, and also a few rural counties, Hendry Glades, Lee, or Hendry Glades and DeSoto. So the thing about the state of Florida is we're so diverse, and every single county is different. Our needs are different. And so what my organization does, and what my job is really as CEO, is to look at our communities and figure out what is going on, what are the needs, and then design solutions is what I would call it. Some people might refer to it as services, but the services are really just part of the solutions for our communities and for the people and the families that live in our communities. So that's what we do, is we're constantly looking at what do our communities need, and then we evolve based on those needs by blending what we're able to get from the federal government, the state government, and local governments to meet those needs.
What is going on in your communities right now?
Well, Fort Myers, as you know, was hit hard by Ian. There's a lot of trauma there, a lot of cleanup still going on.
Let me just interrupt you for a moment there. Yeah. I had a tree fall through the roof of my house in my old house where I used to live in Tallahassee during Hermine. That was in the middle of the night, came crashing through. Before that happened, I could hear trees snapping all around. This was like 6 years ago, maybe, I can't remember. It gets very windy outside now, and I start to panic. It is a thing that is post-traumatic stress disorder and trauma from storms is a thing. I'd really like for you to talk about, because it's not something where you can escape it, because it still rains, it still storms, we still get hurricane warnings, and those folks down in Southwest Florida, the folks in the Panhandle, still traumatized from Hurricane Michael, I know. How do you address that? How are you seeing that play out in the community?
So a lot of things happen, and one thing to keep in mind is everyone's experience is different.
Right.
We were raised differently, our life experiences are different, so we have different responses to trauma or events that happen in life. And the biggest thing is to give yourself some grace and give each other some grace, because for some people, they're going to get through it and they're going to move on right away. And it may not really hit them until later, much later for some people, maybe even years. Other people are going to be experiencing it during the cleanup. They're going to experience grief, because even if you didn't lose your house, you live in a community where there's a lot of loss. You can experience grief vicariously as well through the other people who you care about, or that live in your neighborhood or the next neighborhood over. There's something akin to survivor's guilt. Nothing happened to you at all, or to your house, or to your cars, or to your family, but your neighbor's house is completely gone. It's been devastated. So a lot of what we see is the community down there is really amazing. And I'm speaking specifically about the Fort Myers area, so Lee County, Cape Coral, Fort Myers Beach. Banding together, helping each other out. I have a staff member who lived on Fort Myers Beach. Her house is completely gone. She's staying with another staff member. And, who knows what the future holds. So that's another piece of it. So besides the trauma of the event itself and not knowing what's going to happen, the aftermath of the event, where everything is kind of a mess, and the people that you normally rely on for services of any kind also are experiencing the same thing.
And the uncertainty of...
then you have the uncertainty of what's going to happen in the future. There's the dealing with insurance companies, there's dealing with FEMA, there's dealing with local government and state government, and just people are desperate trying to get help wherever they can. We have a facility, not my company, but a colleague of mine has a facility that hasn't reopened yet because of the damage from Ian. And so everybody's, besides dealing with the trauma, the grief that they're experiencing from all the loss, they're also dealing with the practical things of, how do I get back on my feet? How do I help other people get back on my feet? How do I get back in my house? When is my roof going to be repaired? I mean, there are people up in Manatee County who have houses that still aren't repaired. So it's going to drag out for a while. And one of my folks told me the other day he went out to Fort Myers Beach for the first time, and he said it looks like bombs were dropped.
Wow.
And I do want to say that our providers of the area, Centerstone, Charlotte Behavioral, Say Let's Care, their staff experienced the same trauma as the rest of the community, but they came to work every day. They are providing services to those in need of both mental health and substance use treatment. We had staff out combing the streets right after the hurricane. We had staff waiting in chest deep water to administer medication assisted treatment to make sure that individuals with substance use could stay on their treatment plan, to avoid, any sort of relapse. I didn't even
think of that.
Right. And so these staff have experienced their own trauma. And to Melissa's point, there's uncertainty about the future, but the day-to-day has changed. How you get groceries, how you, your transportation to your work, all of those sorts of things have been upended. And so individuals are having to deal with not only the grief and the trauma, but also this, complete change in their day-to-day life.
It's so interesting. I've covered many, many natural disasters in my tenure, my decades of reporting. And I was in Biloxi after Katrina. I was actually in Mobile when Katrina hit. We went into Biloxi as soon as the dawn broke. And I was there in Biloxi in a beachfront community that was raised. I mean, there were just blocks and blocks raised, similar to what you're describing now. And we were there as people were coming in and trying to locate what had been their homes, and they were finding pictures of families who lived blocks away on their property, or what they believed to be their property, from blocks away. And that trauma is, and at the same time, there was a young mother, frantically looking for, for diapers and formula for her baby. That was her big concern. It was quite, even as correspondents, we are exposed to that trauma. And I know that reporters who are on the, not to minimize anyone's trauma who actually is a victim of these disasters, but it's very intense covering these disasters as well.
We also know that, there'll be an immediate need for services, but there's also a need for services in the longer term,
right?
Because some may not experience their grief or have a reaction until months down the road.
They're just getting through, getting it done, trying to find diapers and formula, exactly. And doing what needs to be done. And then, whoa, then you're struck with the reality.
Right. So finding a way to sustain these services and even increase them over time is going to be really, really important for that area, as well as it's important for the Hurricane Michael area here in the Panhandle, and other areas of the state too. So, that's one thing we want to point out is the sustainability and being able to meet the increased demand.
Well, go ahead. I'm sorry.
The original question to me was, what am I seeing in our community?
And I interrupted you 5 times since then.
No, that's how because I started thinking about Ian because I started with the, the most obvious immediate need. But so an increase in people seeking services, which is positive on the one hand, because as we all know, there's always been a stigma associated with struggling with mental health issues, having an addiction, and people didn't seek out treatment. So on the one hand, it's very positive. On the other hand, it really speaks to the level of need growing, as far as we know and can tell. So there's that with all the stuff going on in the world. I remember when 9/11 happened, I was watching the news cycle constantly. And eventually I realized it was causing me to be really anxious and really angry every single day. And so I stopped. So I just stopped watching it because I couldn't continue to do that to myself every day. And it wasn't that I didn't, think it was important. It's just that I had to take care of myself. And so even realizing things like that, I mean, therapists help you with that kind of thing. Therapists give you a non-judgmental person who you don't have a relationship with otherwise to talk to about what's going on. It alleviates some of the guilt you might feel talking to a family member or loved one who you think is maybe experiencing something worse or the same thing, or who's going to judge you because of the relationship or whatever. But therapists give you the ability to talk to someone where you don't have to worry about those things. And that is very freeing, and it alleviates some of the things that we're talking about and why therapy is so important. And then there are the people who maybe need a little more than therapy, and they need something like care coordination because they have so many problems. Their life is very complex, and they just need a person that kind of helps them coordinate it all, gets them in touch with the right people. Even working in the business I work in, I struggle navigating healthcare sometimes. It's just general healthcare. It's difficult. So, people needing others to help them navigate all the different systems. And then, of course, addiction. Addiction is an epidemic in the United States, if not worldwide. The issue with fentanyl, the scariest thing about fentanyl is how easy it is for people to die when they use it. They could use it for the first time ever. I read an article recently of some high school kids that bought pills from somebody at school, and they'd never done it before, but they took those pills and they died in the bathroom at school. And they didn't think they had fentanyl in them. That's one of the scariest things, is fentanyl showing up in all kinds of drugs, and people don't even know there's fentanyl in it.
Yeah.
And so we're losing young people of all ages, really, at such a rapid, terrible pace. It's not something that the system was necessarily built to handle. So I think prevention is key, and we have to have prevention type programs to build our future, basically, so that kids and young people don't even pick those things up and start using them.
Haven't we?
And I would agree, along with prevention, we have to continue the current services. And so this kind of goes back to what we talked about earlier around the system kind of built, as pieces came along. The system was also built based on medical science. Many years ago, we didn't know what we know today about the brain disorders and about addiction being, and recognizing it as a medical disorder. So the treatment has changed over time, and the policy has to keep up with that. And then, of course, the funding does as well. And then all of that has to happen at both the federal, the state, the local, and the community level. So, that contributes to, to the system being, to the appearance of it being siloed. And to the complications that are there.
Stick with us. We'll be right back with Melanie Brown-Woofter of the Florida Behavioral Health Association and Melissa Larkin-Skinner, CEO of Centerstone of Florida.
Here at Deeper Dive, we want to hear from you, the listeners. We invite you to send your questions, comments, and feedback to our mailbag. You can reach us at deeperdive@cityandstatefl.com. That's deeperdive@cityandstatefl.com. Get your 2 cents in by sending us an email.
Welcome back to A Deeper Dive with Dara. We're heading into the legislative session. There's committee meetings going on right now. I think you're going to probably be running off to one shortly after we wrap up here. What can the legislature do to help address the needs of communities and of Floridians right now?
Well, I'm going to add, I'm a big policy person. I'm a believer in good policy. Even in times when you don't, a state or government, whatever, doesn't have a lot of money, if there's good policy in place, good things will happen. So what the legislature can do is basically the same as every year, and that's rely on experts for input so that we continue to refine and develop good policy based on what we know today versus what we knew 10 years ago or 20 years ago. Melanie may have something to add to that.
Well, along with the policy, obviously funding is very important, for sustainability, and looking at innovations, looking at where we are now in the system and how we can be innovative to move ourselves forward, not only on the policy side, but again, on the funding side, to be able to increase access, because we know more individuals are now seeking treatment, to be able to have services across the continuum from the cradle to the grave, and from the crisis service all the way through, some therapy services that may be done by telehealth or in person. And so just to make sure, to ensure that those are available to the community, to those who are underinsured or who are on Medicaid, and to those who are private pay and have commercial insurance. It's across the board. We have to look.
Well, I know that the DeSantis administration has said that Casey DeSantis, First Lady DeSantis, has made in his first term mental health issues or mental health. I always stumble when I say that, because when I say addressing mental health, it seems odd phrasing, but addressing mental health needs as one of the administration's or her priorities. Has that, and I think that allowing telehealth treatment in post-Michael was part of that effort. So, is there more that aside from funding and with the policy that you're talking about, are there recommendations from the Florida Commission on Mental Health and Substance Abuse that the legislature should be considering this session?
I do want to say First Lady Casey DeSantis has been one of the strongest champions for mental health and substance use disorders that our state has seen in decades, if ever.
Yay,
she has
her.
single-handedly been able to break the stigma and to really move us forward in recognizing the importance of mental health and the importance of treatment. So for that, we are very, very grateful. And in terms of the Mental Health Commission, there were a variety of recommendations that have come out of there. Most are dealing with the need to do kind of a deeper dive, if you will, on in some of the aspects of the system, like data collection, and being able to really be able to move things forward with a data-driven approach, because a lot of that information we don't have in aggregated, in a easy to reach, place. The data is collected across a variety of systems, again, as it should be, because that's, how the system was developed. But it's time to look at that. It's time to look at some policy changes, and those sorts of things. Do you want to add?
And I would just add, Dara, that I think what people need to realize is it's a long game. There are no short-term fixes. I mean, we can do short-term interventions or immediate interventions that address a need that has arisen, like our CAT teams being available in every county in the state of Florida, mobile crisis being available in every county in the state of Florida. And those two things are wonderful, but they're not fixing the system, right? The gaps or the holes in the system, or even bringing it closer together. But it is making sure that people have immediate access to crisis services, or that kids with pretty severe challenges have support for them and their families. But the commission's report and the work that still needs to be done is a long game. It is a big system. We're serving almost 22 million people in the state of Florida. That is not a small number, with, over 60 counties, and every single one of them is different. There's work that has to be done at the federal level to change federal policy. So all of the pieces have to come together. And I mean, that's one of the things actually that Melanie and I both do, is we work at the state as well as the federal level as part of the National Association. And we have to keep our eye on the target and keep moving forward. It's going to take some time, but I think what we have to do is be steadfast in our mission and keep our goal in mind always when we're, making recommendations or making decisions for the future.
I know that that these gears do move very slowly. I mean, I remember, I know that mental health and substance abuse both were, very. I mean, the stigma is an understatement. You just did not talk about it, and I had my own issue personally because it's all about me. In case you guys didn't know that, but Alia knows that. Ryan knows that.
I'm afraid.
I don't know if this is the right time to do a shout out to my therapist, Dr. Paul, but anyway, I had an intimate family member who went through some serious addiction, opioid addiction, at the very start of the whole pill mill crisis, and nobody would talk about it with me. Nobody, there was no help. There was nothing. It was very frustrating. I mean, it was just frightening, frustrating. You're an island alone. Then that eventually changed as it became more prevalent, and there were 0 degrees of separation, and legislators knew folks, their grandkids, their nieces, their nephews, their own children. It became more okay to talk about mental health. Still, we talk about crazies, or we talk about the culture disparages people with mental health issues or who are struggling with depression or anything. That still there's still a stigma associated with that. I mean, thinking about treating addiction, thinking about how long it took for society, for us as a state, for society to get okay with medically assisted medication assisted, I think it's medication assisted treatment for substance use disorder. That took a long time, didn't it?
Yes, it did.
It did. But the good news is this. The good news is we're all moving in the right direction. I mean, I've been doing this almost 30 years, and it is so different today. It was different 10 years ago as opposed to 20 years ago, but today I feel hopeful because stigma has lessened. It's less of an issue. And the 0 degrees of separation, as horrible as it is for the people experiencing it, the silver lining is that more people see it. More people care about it. More people need to talk about it. And so everything, as much as we even talk about shortcomings, challenges, the difficulties in the system, the good thing is that we're even talking about it, that people are interested in it. I remember years and years ago, I would go into a legislator's office or even local government office, and I would talk about mental health, and people's eyes would glaze over. Yes. and or I'd talk about addiction, which was even more interesting because then it was, well, that doesn't affect me or my family.
Yeah, right.
Pretty much no one can or does say that anymore. And people are interested. Instead of eyes glazing over, their eyes brighten up.
Oh, that's
great. And they listen and they call us and they ask us questions. And so I mean, our state association and Melanie have done such a fantastic job of getting the word out there and becoming really the place that legislators and staff go to ask questions because they're known as the experts. The association is the experts. And so it's all coming together. We just all have to be in it for the long game.
I wanted to ask, my understanding is there's a shortage of workers in the mental health and substance abuse community. Can you talk about what you're doing to address that, or how big of a thing is that?
Well, workforce is certainly an issue, but not only in healthcare and in mental health and substance use, but in every sector of the economy. The pandemic has really changed our lives.
Where did all the workers go? Where did they go?
That's the question that
somewhere
we ask
else.
As well. Yes. And so, for us, our community members are the nonprofit community mental health and substance use treatment providers that have been in their communities decades, 30, 40, 50, 60 years. And so they are the safety net in the community. And the work is hard, but the work is very rewarding. And so, we are seeing a shortage of staff, professionally staff especially, to come in. So we're doing some things like flexibilities, and obviously we've adopted telehealth, including the audio only component very quickly. We pivoted to that almost overnight during the pandemic, and now we're seeing folks want to come back in face to face. We're maintaining those crisis services. We are trying to do onboarding more quickly so that if someone comes in a job fair or whatever, we can hire them that day and they can start the next day without having to go through, weeks or days of the
Training.
HR, requirements that are there. Now, obviously, we are comporting to all requirements in terms of background screening and that sort of thing. But at least to be able to get someone in, to be able to begin right away. We're also developing an apprentice program, which we've never had in behavioral health before, at least in Florida, and that is to encourage those who are looking for a career change or maybe have not even considered a career in mental health or substance use, to bring them in to kind of subsidize their work, give them some educational opportunities, and then mentor them through the system.
Okay, there you have it, kids. That's you're looking for a new, interesting, exciting job. I can tell you, never a dull moment, right?
Absolutely never a dull moment, and incredibly rewarding.
And so folks can find out more about this at your website. Would that be www.floridabha.org?
Do you, I was going to say, I would add at the provider level, an individual organizational level, my colleagues and I are doing all kinds of things. Workforce is probably our number one issue, if maybe number two, but certainly high up there. So many of us have relationships with universities where we go in, we speak in classes, we develop internship programs, we develop training programs. So for instance, at Centerstone, we train future psychiatrists because we have a psychiatric residency. We train future nurses through relationships with nursing schools. We train future therapists. I was actually in my master's program, because I'm a trained therapist. I was in my master's program when I went to work for my company 20 plus years ago.
Wow.
So we have internships for therapists. We also have internships for bachelor's level folks, not just for clinical work, but also for human resources, for finance. So we're doing all kinds of things to try to get people interested in the field and to work for an organization like ours. And we also train future psychologists. We have psychology internship programs as well. So we're doing everything we can through building relationships and maintaining relationships and just getting people in so they can see how fantastic it is and hope they'll stay, at least in the field, if not with us.
So again, we're in it for the long game because, we know that there's really no quick fix. And so we've got to play the long game, for sustainability. So by building the new talent of the future and recruiting folks in is one of the best ways that we can address the workforce issue.
I think that was a really good place to wrap things with the hope and a signal to the community that you can be of service and dedicate yourself to a very rewarding career. And I can tell you that I have benefited very much from my therapist, from all the trauma I've experienced. Dr. Paul has been a lifesaver for me. Thank you so much, Melanie Brown-Woofter and Melissa Larkin-Skinner, for joining us on a deeper dive with Dara Cam today.
Dara, it's been an honor. Thank you very much for having us, and we look forward to future conversation.
A Deeper Dive with Dara is a podcast by City and State Florida, hosted by Dara Cam, produced by Ryan Daly, and music for the podcast was recorded by Periodic Labs LLC and performed by Ryan Daly and Danny Reyes.